Hi everyone, it's Dr. Ariel Ostat, cosmetic dermatologist. I wanted to discuss with you a very important topic of neck rejuvenation. One of the common complaints that patients present with is about what can they do about their neck. They've sort of attended with Botox fillers or energy devices on the face, but now there's this discrepancy. So a common complaint that people present with is really either some neck banding. These are vertical bands which are platysmal muscle that over time kind of get hypertrophic and thicken and become evident. Patients also present with crepiness on their neck where their skin is getting what they call like chicken sort of feather skin. And then they're also getting these horizontal creases. So there are a variety of options. For someone who's got some minimal laxity, Botox works quite well in smoothing out that platysmal bands. Those vertical bands last for about 4 to 5 months. A very common treatment that I perform in the office is the use of energy-based devices, mainly Morpheus, which is radio frequency delivered through microneedles. We can actually make that procedure quite safe and painless by basically preoperatively doing the necessary things to make the procedure very comfortable. And over a series of 3 to 4 sessions, we can really get a smoothing out of that crepiness and some horizontal creases. There are some patients who may benefit from actually fillers in those horizontal creases. One thing that I always tell patients is to, when you're looking at your device, your phone, to make sure you're like sort of looking as much as you can straight head on without bringing your chin down so that you minimize the development of these necklines. Fillers so have a place for that. But there are a frequent number of people who present with some fullness, and those are individuals who really benefit from basically localized liposuction performed under local anesthesia. So I usually combine liposuction through the use of tiny cannulas under local anesthesia. We also add some energy-based devices like Accutite or FaceTite, which is basically a cannula that's inserted under the skin to tighten the skin further. One of the newer additions to our toolbox is the use of what we call MyEllevate, which is a permanent suture suspension thread that's actually inserted like a shape of a circle under the neck that actually helps to lift up the submandibular glands, and it basically cuts the platysmal muscle so it can actually allow everything to lay flat. Then that is a permanent suture that helps to really help improve the neckline and improve and tighten the neck. Lastly, there are some patients who will benefit from surgery through a neck lift, and those are patients who have severe laxity where they have an extreme amount of loose skin. Hopefully this information is helpful. If you have any questions, feel free to reach out to us. Have a great day.